Starting in just over a minute, and our guest today is Laura Nic Lochlainn from the World Health Organization headquarters. She'll be talking and we'll be answering your questions about missed opportunities for vaccination. So see you in just about a minute. Welcome from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation, here with Charlotte Mbu. Hello, Charlotte, and welcome. Our guest today is Laura Nic Lochlainn from the World Health Organization headquarters. How are you doing, Charlotte? And welcome, Laura.
Thank you, Rida. I'm doing great, and also great to have Laura with us here today.
Welcome, Laura. How are you doing?
Good, thanks, Charlotte, Rida, and look forward to talking about missed opportunities with you all.
Wonderful. And to kick us off, we're actually going to start with a short video. So if you're joining us, you'll have time to compose and think about the questions you want to ask to Laura Nic Lochlainn, who's responsible for the MOVE, the Missed Opportunities for Vaccination file at the World Health Organization headquarters. Let's get started. Here is the video.
Every day, children around the world access our health services. They may be there to receive treatment, get a checkup, or just accompany a caregiver. But too often, they leave without something that is essential for their long-term health: vaccination. These missed opportunities for vaccination, or MOV, are all too frequent. But if we can reduce MOV, we can increase immunization coverage among children who are already accessing health services. In this video, we will look at what we mean by missed opportunities for vaccination, when do missed opportunities for vaccination happen, how often they happen, and why they matter to immunization programs. First, what is a missed opportunity for vaccination? A missed opportunity for vaccination, or MOV, refers to any time a person who is eligible for vaccination visits a health facility but does not receive all the vaccine doses they are due. The person may be eligible for vaccination if they are unvaccinated, partially vaccinated or not up to date, and free of contraindications to vaccination. Missed opportunities refer to both children and adults, especially pregnant women. Keep in mind that MOV is not necessarily those who are hard to reach, because opportunities are being missed to vaccinate those who are already accessing our health services. Next, when do missed opportunities for vaccination happen? Missed opportunities for vaccination can happen at a sick child visit, when a child visits a health facility for treatment for sickness or injury. They happen at well child visits when the child is at the health facility for preventative services, and they happen when the child is accompanying a caregiver to the health facility. Let us look at some specific situations. When visiting a health facility, a caregiver may not always bring their child's home-based record, so the health worker cannot tell if the child is due any vaccines. Or the caregiver does not know that their child is due for vaccination because the health worker did not explain this during the last immunization visit. Sometimes, the health worker is not trained to screen a child's home-based record to assess their vaccination status, or simply does not ask for the home-based record or about the child's vaccination history. Missed opportunities for vaccination do not just happen during medical visits. They can also happen when the child is already there for a vaccination. A health worker may ask a caregiver to come back another day because she forgot the child's home-based record or because there are not enough vaccines or supplies. Sometimes a health worker does not want to open a vial if there are not enough children, due to fear of wastage. In this case, they may ask the caregiver to return, and in some cases, a health worker may be unsure if an older child is still eligible for vaccinations they missed. How prevalent are missed opportunities for vaccination? Unfortunately, MOV studies reveal this is a prevalent problem among both children and pregnant women. One systemic review of 45 studies found that nearly 1 in 3 eligible children and 1 in 2 pregnant women experienced an MOV during a health service encounter. But these numbers can be much higher. Recent MOV assessments indicate that between 23 to 96% of eligible children had an MOV. Finally, why do missed opportunities for vaccination matter? MOV have a significant impact on immunization coverage. Strategies to reduce MOV can increase coverage between 10 and 30%. And these efforts can have an immediate impact. In one area where an MOV assessment was carried out, a new screening and referral system using coupons was recommended. In the first 4 months of the pilot, the number of DTP3 doses administered increased by 15% compared to the same period the previous year. Reducing MOV can have a big impact, often for a small cost. And many strategies can be adopted now. You should now have a better understanding about missed opportunities for vaccination and their impact on immunization coverage.
Wonderful. So that's a 6-minute video from our friends at the Immunization Academy. We're here with Laura Nic Lochlainn from the World Health Organization. Charlotte is going to ask the questions, and we're keeping an eye on Facebook, obviously, and I'll be maybe rudely interrupting as soon as we see some questions coming in from the Facebook live stream. Over to you, Charlotte.
Thank you very much, Reda, and thank you, Laura, for accepting to be our guest today. And just to say, after watching that video, I think a good part of my questions have been answered. But for the benefit of those who are watching us from around the world, I'm going to ask you first and foremost to tell us exactly what you do at WHO HQ.
Great, thank you. And just to let you know that those videos are available on Immunization Academy, and there are 4 videos there at the moment, and there's another one to be added. So if you want to learn more about missed opportunities and interventions to address missed opportunities, they're available there. So my work at WHO, I work in the life course and integration team within the Essential Program and Immunization Unit in the Immunization Department. And as part of my work, I am the focal point for life course vaccination. I also work on integration of immunization with other health programs, as well as being the focal point on home-based records, which are a key thing to discuss with missed opportunities. And finally, I lead the implementation of the missed opportunities for vaccination strategy at HQ.
Okay, thank you, Laura. And in just about 3 to 5 words, can you summarize what a missed opportunity for vaccination is?
So as outlined in the video, I think a missed opportunity is when we have someone who's in a health facility, they're eligible for vaccination, but they leave without getting the vaccines that they're due. And unfortunately, as mentioned in the video, these happen quite frequently. A recent Kenya publication from Kenya found that 75% of the children that were eligible for vaccination had a missed opportunity. However, this proportion varies by country, but we know that globally, potentially 1 in 3 children and 1 in 2 women have a missed opportunity for vaccination.
So Charlotte, we have the first question from Facebook. So it's Dr. Tanushri Mandal from India who wants to know, can we get to know the coupon system that reduced MOV occurrence?
Yes, so the coupon system was like a referral system. So depending on how a system is set up in a health facility, as caregivers came with their children, they were given a docket, and the health worker would screen the home-based record. And if the child was due or eligible for a vaccine, they would tell the caregiver that once they'd finished their other health contact, that they should go by the EPI clinic on the way out. And they found that they've done this in a number of countries, in certain parts of DRC, and I know that in Chad, they also implemented some form of coupon referral system. They saw that the return of the coupons was very high, and this led to an increase in the number of vaccines that were being administered. So there are many novel approaches that countries can think about to try and facilitate reminders and prompts, so that when someone is physically in the health facility, that you can make the most of that health contact.
Thank you, Laura.
Just to find out, thank you.
Sorry, Charlotte. Before we go any further, we have a couple. I want to acknowledge a couple of people on the of Facebook. So on Facebook, Inusa and Shara and Sangu, who says good afternoon. So good afternoon back to you, Inusa. We're looking forward to your questions for Laura. And then Martha Ngoe from Cameroon, who says awesome video. Back to you, Charlotte.
Thank you, Reda. I just wanted to ask something about the coupon system. Can it still be useful if the mother or caregiver forgets the home-based record?
Great question, Charlotte. And I think it very much depends on the system in place. If a health worker is willing to have the register there and check the register, the health facility-based register, so they can see if that child is up to date or not, that's great. But ideally, the key thing is that the caregiver brings along the home-based record to every health contact. And I think that's something that I really, really want to emphasize very strongly, as this is going to be the key way that we try to ensure that everyone is able to be screened and vaccinated if they have any due or eligible vaccines. And I think in the current context of COVID, I think this is a really important point to make, because we know that many people have not been accessing health during this period. We know that there are probably many children who are due vaccines and maybe haven't been brought to the facility in this time period. But if the child is sick, or maybe is accompanying the mother for another health facility encounter, or is there with the father or some other caregiver, if they have that home-based record there and a health worker has been, has the initiative to think, okay, here's a child, maybe this child hasn't been seen for some months, I'll look at this home-based record, and then they can catch that child up. That is really, really important. And I would love if that happened. Unfortunately, we know that this is something that does not happen regularly. While at the moment, we know that immunization is a great foundation for providing other health interventions. You know, we deliver vitamin A, we get bed nets delivered sometimes at the same contact during immunization, deworming, growth monitoring. But when a child or someone goes for another health facility curative or preventative visit, they often don't get the same level of acknowledgement about whether or not they're up to date on immunization. So I think in this time, if you do have someone who has come to the health facility, it's key that they are screened, and if they are due vaccines, that they are referred to the EPI clinic or told when to come back if it isn't an immunization day.
Thank you very much, Laura. And I still have a number of questions for you, but we are just like under 3 minutes to the end of the session. The time goes so fast. I hope you wouldn't mind taking longer than the 15 minutes set aside.
Sure.
All right. So thank you. I just wanted, now you mentioned COVID-19, and I want to ask you, can we still implement the intervention strategies of MOV in spite of the pandemic? And if there are some adjustments to be done, what can they be?
So as mentioned, I think the key thing is that we make every health contact an opportunity to provide vaccination. So I think that's something that can definitely be done in this time, and is something that I hope will be done. I think that making people more aware of immunization during this period, so the community engagement is key at this time also. And I think also that for health workers, and I think my colleague Stephanie is going to talk about this soon with you all, it's about catch-up vaccination. So what do you do if a child is above a certain age? The health worker needs to be well informed, and there needs to be clear policies in place so that health worker knows that that child can receive the vaccine, rather than saying, no, you're too old, and that child then never receiving that vaccine. And unfortunately, that does happen. And particularly sometimes this can happen more so with some of the vaccines that are delivered later. So this could be the first dose of measles vaccine or the second dose, whereby if a child goes beyond a certain age, the health worker doesn't feel comfortable to provide it. However, we know that if there was a campaign, campaigns stretch sometimes up to 5 years of age, and the health worker can do that. But so this is why it's really important that every opportunity is used. There are interventions. Make better use of the time that people are in the health facility. If you notice that immunization is low, you're not getting as much people coming for the sessions, then you need to try and do better community engagement, but also make sure that people know where the clinic is, make sure that the times are well known to the community. These very simple approaches can still be used. And also it's reassurance people need to ensure that they know that if they come to the health facility, they will be safe.
All right, thank you very much, Laura, for talking to us about reducing missed opportunities for vaccination today. And it's a very rich topic, and it's very useful if we have to reduce inequities and improve immunization coverage. So can you just tell those who are watching if there are additional resources that they could refer to get more information about these MOVs?
And just,
yes.
Laura, we have Dr. Tanushree Mandal, who's asked additional questions about the coupons. Where could she go? Can she find the information about that story on the WHO website? What's the right place to go? I'm sharing the MOV page on the WHO website, of course.
Great, thanks. So this is where the resources are for a lot of the strategies. So in our intervention guide, we have 3 guides. So if you go over Reddit and down the page, just scroll down, you'll see the planning guide. We have a methodology guide, and we have an intervention guide. So within these, the intervention guide is key at the moment, because planning and methodology guide are about conducting assessments. And at the moment now is not the time to be carrying out assessments, unfortunately. So, but with the planning guide, this is an opportunity where you can look through the different specific health system related issues, or caregiver related issues, or health worker related issues that could help to increase vaccine coverage and reduce missed opportunities. So the examples should be in there, and there's loads more discussion points about what can be done, particularly related to health system issues at the moment that health workers could address at the health facility level to prevent missed opportunities.
Thank you very much, Laura. Reda, over to you.
Yes, thank you, Laura Nic Lochlainn from the World Health Organization. The point is, as part of the Peer Hub activities, we are inviting participants in the Peer Hub as well as subject matter experts from partner organizations and global partners who can share the expertise that many participants have been requesting support with. Reminder again, the Peer Hub is about sharing experience, spreading ideas, and taking action to keep vaccination going during the pandemic. So you'll find by following us on Facebook, it's important that you both if you like it, and then also check the options to make sure you get a notification. We don't always announce these lightning chats, and if you do attend, make sure you have some questions ready. We got some great questions today. Great. Thank you, Charlotte, and Laura Nic Lochlainn from WHO. Thank you so much for being our guest and accepting our invitation.